trying to achieve to gain the best advantage of each individual system. So it's not unusual to have a little cocktail of bone grafting used to gain both the necessary hardness and the necessary speed to get the ideal outcome.
So we've talked about this guided bone regeneration, but are there any other techniques that are available to a patient?
There are several. For example, we can do what's called a block graft. And a block graft is taking a block from the jaw, let's say in the lower molar region, and we can take that block and then we can prepare it in such a way that it can be actually placed like mortising a piece of wood into the defect wherever it might be, and then intimately connecting that piece with a couple of screws and then covering it with the gums, and then that will end up becoming beautiful bone in approximately 4 months.
Wow.
There are other techniques where you can take the bone around the defect and you can split it and then put a little expansion screw in there to separate the two pieces of bone, creating a space. And in that space, the body will regenerate new bone. This is called distraction osteogenesis and can also be effective in some compromised situations. One technique that we use a lot on a day-to-day basis, if you only have roughly 4 millimeters of bone width, but we actually need 7 or 8 millimeters to put the implant into, we will take a little instrument and split the bone along the 4 millimeters so that we have 2 millimeters on each side. And then we expand that bone with certain instruments because the bone is quite moldable and quite pliable. And we can actually expand those 2 millimeter sections of bone. So by the time that we place the implant in and place something into the center, it will become 7 or 8 millimeters of bone. That's called ridge splitting. It's very much like you see when you see some road construction and they have these really heavy cast iron plates that they put into the road, and then they have this large, like a big screw in between the two plates to prevent the asphalt from caving in on the workers as they're working down below the surface of the road.
Right.
It separates the two pieces, and that's what we do when we do a ridge split procedure. There's also another procedure where we can take a block of bone from another human being, of course, a cadaver type of bone, and this bone is also well treated, and this can be screwed into the defect and act as a wonderful source of new bone. And what's super exciting and where we're headed with all of this, and what really is making this so fascinating, is that now we actually have what we call proteins, bone morphogenetic proteins available that we can actually buy and place into the defect with a certain system that will turn on the native bone cells to grow new bone. So it's these little proteins that we stick right into the defect and just cover it. You'll get actual native bone growing because we're unlocking the system of nature to grow new bone in an osteoinductive manner.
Again, I know I sound like a broken record, but all of this is incredible. And we've talked about at least 6 different options for you as a doctor to treat a patient when dealing with a bone graft. But how do you choose the best one?
As with anything that we do in dentistry, we should be guided by the principle of how can we get the best possible outcome with the least invasive technique. Because as I said several times before throughout these podcasts, there is no dentistry better than no dentistry.
Right.
So the less we can do and the less invasive we can make the procedure, the better it's going to heal. And so our goal is always to try to take the technique that creates the least amount of morbidity or patient suffering, so to speak, and that's how we determine it. However, of course, we are many times faced with issues that are already very compromised. So, for example, if a patient has had previous surgeries through various different reasons and has scar tissue, which really means no blood supply, then we need to use techniques that will help us grow new blood vessels, and that's where maybe we would use some of this bone morphogenic protein to really help us. But if it's a regular, normal situation, we can use the simple techniques of just putting some bone particles from whatever source we choose and put them into the site, cover them with a membrane, and this will be very predictable in 3 to 4 months from now. So basically, it's previous trauma. It is how easy is it to access the area? What does the patient prefer? How healthy is the patient? Are there any systemic factors that might lead to a less than ideal outcome? Mm-hmm. Is the patient a smoker, which obviously compromises the overall outcome?
Right.
And what are the aesthetic demands of the situation? So there are many different circumstances that determine what materials we will use or what technique we will use. Oftentimes we focus so much on the excitement of the techniques that we have available, but we should never forget that the patient doesn't really care about the techniques that we provide. What they really care about is they end up with teeth that they can use and function with and be happy with how they look. We can't ever lose sight of that. And so ultimately, all these techniques are just simply serving the purpose of providing the patients with the ultimate goal of ideal function and long-term stability and good aesthetics.
All right. Well, again, all of this is so fascinating and just incredible to think about the tools and techniques available today. But unfortunately, we are out of time. In our upcoming podcast, we will be talking about some of the techniques available for soft tissue grafting procedures. And if you know someone who would benefit from what we have talked about here today, somebody who might be thinking about getting an implant or finds themselves suddenly having to get one, please go ahead and share this with them, and they're going to get all the information they need to know so they can be confident in what's going to happen to them next. So you can always reach Dr. Ickert at www.ickertdentalimplants.com. That's ickertdentalimplants.com. And you can reach him by telephone at 604-881-1381 or call him toll free at 1-866-931-1981. Dr. Ickert, again, thank you so much.
Thank you, Nick. It's a pleasure.
Thanks for listening. At Eckert Dental Implant Centre, we are committed to providing you with the very best in modern and advanced dentistry. If you would like more information about dental implants and our extensive range of specialized dentistry services, please call us today at 866-981-1381. That's 866-981-1381. Or visit us on our website at www.ickertdentalimplants.com.
Local stories, local voices. We're localwebradio.fm.